Hola, welcome to Adelante Chicago. I'm Lourdes Duarte. We begin with the push to bring attention to a project that's meant to help one of Chicago's largest Latino communities. Humboldt Park Health has partnered with Mikey O for what will be known as Girl, Let Me Tell Ya. The special comedy show will bring attention to a very serious topic, though. Daisy Rodriguez with Humboldt Park Health and breast cancer survivor and comedian Benita Santillanes are here to explain what they will be doing. Thank you for coming in, ladies. Always nice to see you.
Thank you.
So this sounds like a whole lot of fun because you have partnered with one of my favorite people, who is Michael Kendo, to deliver a really great show. So I'll let you sort of tell us about it.
So we have a show coming up on October 3rd. At Joe's on Weed, with an opportunity to bring some joy, some laughter to a serious topic that disproportionately affects the mortality of Latina and African American women. And this is a different way of taking that opportunity to showcase an event and a partnership to help improve the health and wellness of women. The proceeds from this event will help with screening, so the cost of screenings for uninsured women that we'll be able to do at the hospital.
And I think, and we'll talk a little bit more about the event, but it's like you sell 2 tickets, you're able to do one screening, screen one woman.
Absolutely. Yeah. So the average cost, self-pay cost for a mammogram is $50. So for 2 tickets, that covers the cost of a mammogram.
I love it.
For a woman.
That's good help. Okay, Benita, I want to bring you into the conversation. So you are going to be one of the comedians at the show.
Yes, I am.
All right. So tell me about the show and how excited are you to be a part of this great event?
I am really excited about this show. I've worked with Mikey O and doing a lot of his comedy shows throughout the years.
Yeah.
Even before I was diagnosed with breast cancer, I did some comedy for him because I am a below-knee amputee. So I, would do comedy for him with that and things like that. And I'm just really excited about this to be able to support, the other men and women that go through breast cancer.
Do you have your set ready?
I do. And then just working with the crowd, that's the most important thing, is when you get there, you just kind of, you feel out the crowd and you work with them and you just have a good time. Try to bring some positive light to something that's so serious.
It's good all around because, yes, it brings awareness to breast cancer. It raises some good dollars and it gets the entire community involved. So it's a win-win-win.
Absolutely.
Tell me about Humboldt Park Health, because you guys have been around for a really long time.
So Humboldt Park Health has been in the community for over 115 years, serving the community that has been there and predominantly Latino. And as the community has shifted, the community has still predominantly been Latino and African American. So we're still serving the Humboldt Park community that maybe moved a little bit further north and west as they've been a little bit displaced. But we have been serving the community and focusing on health equity. What are the things that we can do to help reduce disparities and improve health outcomes within the community?
And some of the things that you're seeing in, let's say, Humboldt Park are also issues that are affecting people in Little Village, in McKinley Park, in Brighton Park. So it's, we talk about Humboldt Park Health, but it's really affecting all Latinos.
Absolutely. When we look at let's look at breast cancer. Breast cancer is is the second leading cause of death of women in the United States. However, breast cancer in the African American and the Hispanic population, the Latino population, is the leading cause of death in women. And so when we look at the overall incidence in the communities that we serve, and so how do you, first of all, you have to detect breast cancer. So we look at the screening rates in the communities that we serve, such as Humboldt Park, Westtown, Austin, Hermosa, Belmont Cragen, Dunning, which are predominantly Latino. When we look at those screening rates, only 42% of those women are being screened for breast cancer. Yet the same community areas that we're serving actually have a 58% diagnosis rate compared to the city of Chicago.
So I want to talk to you because you're out in the community a lot. You talk to women who maybe are looking to get a screening but perhaps don't do it and put it off and put it off. What do you hear from them as to the reason? Does it come down to dollars, or does it just come down to not being aware or not knowing where to go or where the resources are?
It's a combination of everything. because a lot of people of color may not have the right insurance that provides for it.
Right.
Insurance will not do a lot of preventative. They will do something once it's diagnosed.
Okay.
And a lot of it is from fear.
Yeah.
I know when I was diagnosed, I was asked to get a mammogram. I had a mammogram the year prior, and I was going through some medical things and stuff, trying to lose weight and stuff like that. And what wound up happening is my doctor actually found it. He told me that I needed to get a mammogram in October of 2017. I didn't get it. I was like, why am I going to get it? I had one a year ago. I don't need another one. And he called me and said, I need this to, get a whole medical
full picture,
perspective for you. And I went in December, and I went in January, got the mammogram, and I was diagnosed in January 31st of 2018.
Wow.
So it was thinking that, well, it won't happen to me. There's no breast cancer on either side of my family. I didn't live what they would say your typical lifestyle of breast cancer, but I was diagnosed with invasive ductal carcinoma, stage 1, and it was a very rare cancer, only 2% of cancers, and I chose to have a bilateral mastectomy with implants.
Okay.
In lieu of chemo.
But it shows you the importance of getting these
Absolutely.
mammograms for the
Absolutely.
entire community. Okay, so the event will raise funds. 100% of the proceeds, I am told, will go to some of these breast cancer screenings. So let's get the information up on the screen. For those of you that maybe want to be a part of the show, want to participate, or want to make a donation, it's MikeyOShow.com, where you can get some tickets. And then tell me the date again, October?
3rd.
3rd.
Yes,
All right.
next Thursday.
Thank you, guys. I
Thank you.
appreciate it. We'll see you
You're
back again
welcome.
soon.